Hello and welcome. Thank you for joining our live stream. We're here today with Dr. Robert Sonnenburg of BayCare Clinic, Ear, Nose, and Throat, Dr. Steve Zent of Oral and Maxillofacial Surgeons, BayCare Clinic, and Dr. Prabhpreet Singh of Aurora BayCare Cardiology. Today we're hosting a session on sleep apnea and the lesser known ways it can affect people. Dr. Sonnenburg is board certified by the American Board of Otolaryngology in otolaryngology and in sleep medicine. Dr. Zent is board certified by the American Board of Oral and Maxillofacial Surgery. Dr. Singh is board certified by the American Board of Internal Medicine in cardiovascular disease and in internal medicine. He is fellowship trained in cardiovascular and clinical cardiac electrophysiology. Visit our website for more on the doctor's backgrounds. Before we get started, we want to invite you to ask any sleep apnea related questions in the comments section. We'll do our best to answer your questions in real time. If we run out of time, please watch for a response online after our live broadcast has ended. Also, feel free to give us a like if you're simply enjoying today's topic of conversation. With that said, gentlemen, let's get started. We'll start off with a cross-section illustrations of the mouth with and without sleep apnea. And we'll start off with you, Dr. Sonnenburg. Using this illustration, can you explain sleep apnea?
Sure, thanks, Femi. So in this illustration, this is an illustration specifically demonstrating obstructive sleep apnea. So normally when you're sleeping, we're in the situation that's on the left-hand side picture. Those blue arrows are supposed to represent airflow. And as you can see in the diagram, air is entering the nose and the mouth. And that air is traveling then through the nose and the mouth down into the lower airways and eventually into the lungs. The structures in the upper airway, the structures in the nose and the mouth and the throat are open, and that's the normal situation. And normally the tongue and the palate and the walls of the throat stay open because there's a certain degree of muscle tone that's present. In all of us, when we go to sleep, that muscle tone decreases, but in individuals who have obstructive sleep apnea, the muscle tone decreases too much, and it actually allows the upper airway to collapse or close. And that's what's being demonstrated in the diagram on the right-hand side, that those blue arrows, they're getting through the opening of the mouth, front of the mouth, the front of the nose, but when they get back into the throat, in what we would call the pharynx and then the larynx, the voice box, sure. They're getting blocked and turned away. And that happens when a person has obstructive sleep apnea. When that happens, the oxygen level in a person's blood starts to go down. Their brain senses that and says, hey, something's not right here. And then the brain experiences something called an arousal, where an individual goes from a deeper state of sleep to a lighter state of sleep. And that transition in sleep state, becoming more awake or lighter sleep, restores the muscle tone and allows the airway to reopen. This cycle happens over and over again throughout the night in a person who has obstructive sleep apnea.
So sleep apnea isn't just a fancy term for snoring.
That's correct. Now, snoring, I think everybody knows what that sounds like or has experienced that at some point in their life.
Sure.
That is a common symptom of obstructive sleep apnea, but in and of itself, it isn't obstructive sleep apnea.
Okay. So you mentioned obstructive sleep apnea. Are there other types? And if so, what are they briefly?
Yeah, so there are other types of sleep apnea. There's obstructive sleep apnea, what we'll mostly talk about today. There's also a condition called central sleep apnea. In central sleep apnea, an individual also has pauses in their breathing, but it's because their brain isn't telling them to take a breath at the correct time. In adults, the more common situations we might see that would be an individual with congestive heart failure, certain neurologic conditions, or certain medications they take, like pain medications.
Okay. So what are the symptoms of sleep apnea? I mean, how can we tell if we have it? It sounds like half the time we're asleep anyway. So how
Good
would you
point.
know?
Good point. And that often is the case, that the individual who has obstructive sleep apnea might not know they have it. Often their bed partner is the individual who's alerted them to the fact that that's going on, and kind of is, encouraging them to come and seek medical help for it. In terms of symptoms, when I talk to patients in my office, I usually break those up into two categories.
Sure.
One category I call quality of life symptoms, and the other category is heart health symptoms. We're fortunate to have a heart health expert with us today, so I'll leave that for Dr. Singh to talk about.
Sure.
But in terms of quality of life symptoms, the snoring's a big deal. For couples, it's a big deal. Oftentimes, it's bad enough that husband and wife are not sleeping in the same bedroom together anymore. It's often bad enough that your buddies at deer camp have said, hey, you got to get something done about this or you're not coming back.
Sure.
And so the snoring's a big deal. Additionally, people who have untreated sleep apnea, it's harder for them to focus, concentrate, pay attention to tasks, so it might affect their work performance. It also puts you at a higher risk of car accident. So those are some of the symptoms that people might experience.
Okay, let's switch it up a little bit and go to you, Dr. Zent. What role do oral and maxillofacial surgeons play when it comes to treating sleep apnea?
Well, the role of an oral and maxillofacial surgeon can be either surgical or non-surgical. Most commonly, it's non-surgical as far as the typical case throughout most of the day. As discussed by Dr. Sonnenburg, sleep apnea is typically multifactorial in anatomic positioning of the soft tissues and the patient may need to utilize any one or multiple treatment options. As an oral surgeon, typically, the majority of the patients I see, evaluating them for possible use of a mandibular or a lower jaw advancement appliance to aid in their airway anatomy while they're sleeping. In some extreme cases, we do evaluate patients for upper and lower airway issues that are anatomic, in which they may benefit from having upper or lower jaw surgeries and advancements. That gets a little bit more complicated as far as working with orthodontists and other surgeons and those things. But the more typical case on a daily basis is the non-surgical management.
Okay. Well, how often do oral and maxillofacial surgeons treat people with this condition?
Well, interesting enough, I was thinking about this, as we're getting ready to do this today, and every day I have patients in the office with this. I was going to at one point say, it's every week, but actually it's every day. I have multiple patients. Interesting enough, it's interesting throughout the years. I used to see a plethora of patients that were, I guess, for the most part, a little bit more elderly, or they had a lot of comorbidity conditions. They had a lot worse symptoms. But over the past several years, as the awareness of sleep apnea is out in the general public, people are understanding it a lot more than they used to. I'm seeing younger and younger and healthier patients come in, both for the quality of life issues like Dr. Sonnenburg talked about. Deer camp is a very common scenario I get to talk to patients about. Some of the buddies will throw things at them because they keep snoring so much and things like that. But not only quality of life issues, but our society in general, we're learning to have a bigger appreciation for prevention of health issues and not seeing them overall. Dr. Singh again is with us today, and he can talk a lot about some of the other health issues as well.
Okay. Can you discuss how sleep medicine physicians and oral and maxillofacial surgeons collaborate when it comes to treating sleep apnea?
Well, physicians and oral maxillofacial surgeons, really, we need to collaborate in treating these patients with sleep apnea. As we talked above or before, multifactorial conditions will have ramifications in health that cross multiple medical disciplines, if you will. Collaboration allows for the appropriate diagnosis, treatment, and helps us avoid unnecessary complications undertreated patients and untreated patients. For instance, many patients will come to me as their starting point, and they'll talk to me, and they only really want to perceive treatment regarding their noise of snoring. And that's what their main concern, their chief complaint is. But I have to spend a lot of time educating on them and telling them the importance of having effective treatment through using multiple physicians and to evaluate them for these other complications. Simply addressing the noise of snoring is a mistake. Again, Dr. Singh's awesome enough to be with us today, and he can talk to us volumes regarding the systemic ramifications.
Right. Great, good stuff. And yes, on that note, Dr. Singh, you're up. Sleep apnea can increase the risk of high blood pressure. How's that detrimental to heart health?
You're correct, Femi. Sleep apnea can directly lead to high blood pressure. Frequently, we'll see patients who have resistant high blood pressure, and that's actually related to their sleep apnea. And, there's a reason high blood pressure has been called the silent killer. It doesn't have any symptoms by itself, but high blood pressure can affect your heart health in multiple ways. It can cause heart attacks, it can cause rhythm problems, it can cause stroke, and not just the heart. High blood pressure can also affect your other vital organs, including your kidneys, your eyesight, and may even cause things like blindness, kidney failure, things we don't really think about.
Right. So are there other heart ailments that can be directly linked to sleep apnea? And if so, can you talk about some of them?
Yeah, absolutely. So sleep apnea can affect basically every aspect of heart health. So, starting from electrical heart rhythm problems to the way the heart muscle is pumping, and even, the blood flow inside the arteries supplying the heart muscle. All of these things can be affected by sleep apnea. And so, clinical manifestations of sleep apnea would include electrical heart rhythm problems, which are both slow and fast heart rhythm problems, can lead to a heart attack, and can even lead to heart failure and strokes.
Okay. Beyond that, are there other issues that can occur if sleep apnea is not treated or managed properly?
Oh, absolutely. So, frequently when we see patients in the heart clinic, we end up seeing patients for heart problems, but they are being driven by undiagnosed or untreated sleep apnea. And so many times these cardiac problems can be very hard to treat. And that's because we are not really addressing the underlying issue, which is sleep apnea in many of these patients. So absolutely, this can cause severe heart failure, severe heart rhythm problems, hard to control high blood pressure. And all of this is being driven by sleep apnea.
Right. So how can you tell whether someone's heart ailments are actually related to sleep apnea? Like how
That's actually a hard question to answer, and some of that is some of that decision is made in retrospect. So whenever we see patients who are having issues with controlling their blood pressure or their diabetes or their heart conditions,
right,
and we are suspecting sleep apnea, we start treatment for sleep apnea, and if we see a dramatic improvement, then we associate that improvement to getting the sleep apnea treated. So that decision is sometimes made in retrospect.
Okay, good to know. Thanks for the information, gentlemen. If you're just joining us, we're here with Dr. Robert Sonnenburg, Dr. Steve Zent, and Dr. Prabhpreet Singh. We're discussing sleep apnea and the lesser known ways it can affect people. Dr. Sonnenburg, back to you. How do you actually diagnose sleep apnea?
Sure. So diagnosis of sleep apnea usually starts with interviewing a patient, someone who comes into the office with clinical concerns about what they're experiencing. Also, it's really helpful to interview their bed partner.
Sure.
Examining the patient and looking for craniofacial measurements or craniofacial findings that might suggest that the person's at risk for sleep apnea. Ultimately, if you have an individual who you think has sleep apnea, you need to do a test to confirm that, and that test is called a sleep study.
Oh, sure. Can Can you tell me who is at risk for sleep apnea?
Sure. So a common thing that I use in my office or that people can use themselves is there is a questionnaire called the Stop Bang questionnaire.
Okay.
That you could Google it. I think we might have had a link to it at some time on our website. But basically, it's a series of questions to ask yes or no. And if you have those, you're at higher risk. So Stop Bang's an acronym. The S is for snoring, T is for tired, O is for observed apneas, and the P is for high blood pressure. Bang, the B is for BMI. A is for age, greater than 50. N is for neck circumference, greater than 16 inches. And G is for gender. Men are more prone to obstructive sleep apnea than women, at least premenopausal women. Postmenopausal women, it kind of evens out. So you could take that questionnaire, and if you are positive for 4 or more of those, you're at risk for sleep apnea.
Okay. Doctor, I know many of us know what a CPAP is, or that we know that it's used for treatment of sleep apnea. But can you explain what it actually is and
Sure.
what it does?
Yeah. So CPAP machine, that stands for continuous positive airway pressure. It's a device that generates a positive pressure, and that pressure is administered to the individual's airway through a tubing or a hose, and then a mask that fits either on their nose or their nose and mouth. And if you think back to that diagram that we looked at the beginning,
Right.
when we have an airway that is collapsing or closing, that positive pressure opens that airway to reestablish a patency or an openness for air to flow. And that's all a CPAP is. You know, most people think about it as a mask to treat sleep apnea. That's true.
Right.
But the little device that sits on your nightstand, that's doing the work of generating this positive pressure to reopen the airway.
Okay. So there's another treatment option that's sort of made waves in our area. Can you tell us about it? I believe it's called Inspire.
Sure. Inspire's a brand name or company name for a hypoglossal nerve stimulator. This is a treatment that was FDA approved in the United States in 2014. It has 3 components. This generator that you see on the screen, that's implanted underneath the skin in the right upper chest.
Okay.
And then it has 2 wires or leads, one that goes between the ribs that senses your breathing, and one that goes to the hypoglossal nerve. The hypoglossal nerve is the nerve that controls your tongue. And the idea with the device, you turn it on with the remote control when you go to bed.
Okay.
It senses your breathing pattern, and then it sends a series of mild stimulations to that nerve to move the tongue forward and open the airway from front to back to reestablish some of that upper airway muscle tone when you're sleeping at night.
So, quick question for you. So this device isn't going to wake me up, is it, as it kicks in?
Great question. For most individuals, it doesn't. Your hypoglossal nerve is a motor nerve, meaning that it tells a muscle to work. It's not a sensory nerve. It doesn't have feeling. So for most individuals, when this nerve is getting stimulated, they don't like feel a zap or a zing or anything like that.
Okay.
And it generally is pretty easy for people to get acclimated to and to tolerate. We also set the device up so that when you turn it on, for most of my patients, it has a 30-minute delay to allow them to fall asleep before it starts working. That can be adjusted based on patient preference.
Okay. All right. And that answers the one question that we actually had come in. Somebody asked, do patients feel that stimulation? And you just answered that. So thank you.
Mm-hmm.
All right. Let's see. Dr. Zent, you are up, sir. Why would a patient be referred to see an oral and maxillofacial surgeon for sleep apnea? Can you talk a little bit about that?
Oh, sure. The referral for oral surgery consultation typically would be after the appropriate evaluation and a formal sleep study like Dr. Sonnenburg mentioned is already completed.
Mm-hmm.
So typically these patients are already diagnosed with their obstructive sleep apnea. I kind of get four general categories of patients that's referred to me. The first one is kind of an obvious one where the patient's diagnosed with mild to moderate sleep apnea. And quite frankly, a lot of these patients can achieve very good results with just a simple lower jaw advancement oral appliance. And they want to use that as a first line agent for any number of reasons. A second group is patients who have maybe moderate to severe sleep apnea or even mild sleep apnea. They've already tried other modalities such as the CPAP and those things, or for whatever anatomic reason or some claustrophobia reasons, they're not a good candidate for those other therapies. So it'd be, used as a second line agent or third line agent in those situations. I also have some patients that alternate between two of them. I have some patients that travel a lot for work, and they, come to my office and they say they don't want to be traveling with the CPAP machine, or they have mild sleep apnea anyway, and so they don't want to do that, and they want to use the oral appliance, which is a lot easier to travel with. Again, going back to the hunting situation, some patients go hunting, they go camping, they don't necessarily have electricity with them, so they will use the oral appliance when they're away from the home and use the CPAP when they get back. And then there's also some other patients that will they'll do great with an oral appliance, or they'll do very well with the CPAP therapy. However, after so many days, they just kind of need a break, and it's a tolerance issue, and they can also go back and forth. I've had a few patients use both at the same time. So again, it's not one size fits all. Okay. It's every patient's dealt with quite individually. And then the other last category that I get, which is less frequent, but some patients have anatomic issues where surgery for the upper and lower jaws is actually indicated.
Okay. Talk a little bit about this device that we're seeing on screen now. Is this the oral appliance maybe that you would have been referencing?
Yes. This appliance.
How does that work? Is that something I just put in my mouth and I go to sleep? Like, what is this?
For the most part, yes. Most patients tolerate this. Interesting enough, a lot of patients come into the office and they expect this to be like this large contraption that's going to be very uncomfortable. And frankly, what it really resembles is a mouth guard, or if anybody's had braces before, they have kids in the house with braces, it's the same type of a basic design as a retainer would be, and it does have the attachments to it. You can see the one that's on the top has more of a hook device that's adjustable, and the lower part of it has a receiver. So when they pose each other, essentially what it does, it's more of a passive alignment of the lower jaw, and it helps control some of the positioning of the tongue and the oral soft tissues in the pharynx or in the back of the throat. Again, as Dr. Sonnenburg talked about, when patients get into that deeper plane of sleep, the good reparative sleep, that muscle tone is what helps affect the positioning of the soft tissues. And this just aids with that. And this is just one of many, many appliances.
Okay. So generally speaking, would you say your treatment method for sleep apnea is maybe this oral appliance, and then in some cases, some surgical procedures? Like, how would you sum up your treatment method for sleep apnea?
I guess the treatment method, again, when the patients get to our office, the idea is they've had the official diagnosis already completed. I start just like any other patient, with the physical exam. But part of the early discussion is, what have they done that's been helpful or not helpful? Have they tried CPAP already? And some patients, I just tell them, it might be a good idea for you to at least try CPAP first. Some of them say they try CPAP and they don't do well, but we get their general response. And then we talk to them about expectations and any possible limitations that this appliance would get without having surgery in those. And we kind of walk them through the whole process and evaluate them. Their mouth and their dental condition has to be pretty stable in order for this to be a lasting device.
Okay, great. Switching gears, Dr. Singh, can you please tell us again how sleep apnea can affect one's heart? Because I think when we hear sleep apnea, we automatically think sleep medicine. We don't often think, cardiology or heart health. So just kind of reiterate for us, how can sleep apnea affect one's heart?
It's a good question, Femi. So, when patients have sleep apnea, what's going on at night is they're having cycles where they stop breathing and then they start breathing again, and this cycle is repeating throughout the night. And so as a result of that, the oxygen level in the body fluctuates, the carbon dioxide level in the body fluctuates dramatically. There's a release of adrenaline during all these times when the body is literally being asphyxiated. I mean, all those times when the upper airway is collapsed, causing the snoring is literally a manifestation of somebody being choked. So all that puts a lot of stress on the body in general and the heart specifically. And that leads to a lot of high blood pressure, heart disease, including rhythm problems, heart attacks, and strokes.
Wow. So in that case, what can we do to protect our heart health as we explore treatment options for sleep apnea?
If somebody has sleep apnea, it's very important for that to be treated. There is a lot of stigma associated with sleep apnea, and there's a lot of misconceptions about sleep apnea. So, our job as doctors is to educate patients and try to make them understand what the problem is. And so once the problem has been identified, it's the right approach is not to essentially, push it under the rug. The right approach is to tackle the problem head on. Right. It may not be CPAP that's the answer. It may be something else that's the answer, like the Inspire device or, jaw advancement or even surgery. But we have to help the patients find out the right answer for them. Just, in general, for treating heart problems, we talk about, the American Heart Association talks about 30 minutes of exercise 5 days a week,
Right.
Limiting alcohol intake, tobacco intake, and just keeping an eye out for what you put in your cart. What you put in your cart is important for your health. And so read that label the next time you go to the grocery store.
Right. Okay, I have a couple questions that came in here. This one's for you, Dr. Sonnenburg. Where would you suggest people go to find information on the electronic device? And I'm assuming that's Inspire. Where would you want to direct them to go for more information about Inspire?
Yeah, if you wanted more general information about Inspire, the company has a website, www.inspiresleep.com, that has good information on it. And that'd be a good starting point if someone wanted to explore it.
Okay. This one is also for you. If CPAP has been tried, then is Inspire essentially the next option?
That's a great question. Difficult question without knowing more about the person. I see that's all day, every day, seeing people who have sleep apnea. Most of them have tried CPAP. And I would say most of them don't end up getting Inspire. And the reason for that is a lot of times people have tried it, but there are things you might be able to do differently with your CPAP. That might be a mask interface, that might be pressure settings. I see very commonly people who have a hard time breathing through their nose, having a difficult time tolerating CPAP. So sometimes something that is helping them breathe through their nose would be better. Okay. So that would be kind of one of the things I would explore is, has CPAP, have all the options been tried there? Second thing is, does a person want surgery? Because if they don't, then oftentimes an oral appliance is an excellent non-surgical treatment option. That might be something to do. Thirdly, is Inspire the right surgery? There are other surgical procedures for obstructive sleep apnea. Sometimes one or the other of those might be more appropriate for the person. And there are some fairly specific criteria as to who's a candidate for Inspire. So that's something we'd have to explore with people too. So it's a little complicated. I think one of the nice things that I enjoy at being a physician at BayCare Clinic is that I have fantastic colleagues in these other areas of medicine that I can rely on and collaborate with. And so when an individual comes to the office, we can say, what's the right thing for you?
Excellent. That's a lot of great insight today. We're going to kind of wrap things up, but I want you to leave our viewers with any words of wisdom. So Dr. Zent, last thoughts.
I guess one of my words of wisdom, and I alluded to that earlier, was the fact that, with the awareness just in general in the public, it's young patients, it's, middle-aged patients, it's all of the above. The stigma should be pretty much gone. I mean,
Right.
I would say, it's amazing how many patients come back after they have found one of these treatment modalities and they tell me they feel great. And then their only regret is they didn't do it sooner. They didn't address it sooner. Some of them, like Dr. Singh was talking about, their blood pressure is maybe a little bit easier to manage. Maybe they can get off some other medicine and those things. But I guess I hear the success stories a lot where the patients are just not upset, but they regret not doing it sooner.
Right.
And they're very happy.
Right. Dr. Singh, a little morsel of wisdom from you.
Well, I would just reiterate again, it is important for patients to understand that sleep apnea is a treatable condition. It is something that has many ways of being treated. And so, as their doctors, we are here to help them. And so we can explore all these options. The right approach, again, is to tackle the problem head on and, go into seeing your doctors with an open mind.
Okay. And Dr. Sonnenburg, I'm going to change it up on you a little bit. We have a question that came in. It's pretty specific, so I'm going to kind of paraphrase.
Okay.
But if you have a loved one in your life or someone that you know in your life, and they definitely have sleep apnea, they've been diagnosed, but they're a little hesitant to follow some of the treatment proposals, what's the advice for somebody who has to help that person navigate that, and for such an individual or individuals?
Yeah, tough question. I think that perhaps I'm going to read something into that question is that perhaps that individual has not either been really fully educated on the problem and what it could lead to, and or maybe the person hasn't really been given all their options. I mean, ultimately, we're here to help people, not tell them what they have to do or what they're
Right.
going to do.
Right.
And so, just find a provider that you're comfortable with, whether that's your family or whether that's your primary care doctor or someone who specializes in sleep medicine or other specialists who treat people with sleep apnea, and just come in to get the information. And if I think if you find somebody who you're comfortable with, who could say, hey, here's the problem, here's what we're worried about, and you have options. Here's what they are. I'm not here to tell you what you have to do.
Right.
I'm just going to tell you, here are the options. How can we find something that's going to work for you?
Right. Thank you. Dr. Sonnenburg, Dr. Zent, Dr. Singh, thank you so much for your time and for sharing your expertise today. And viewers, thank you for joining us. If you have additional questions for Drs. Sonnenburg, Singh, Zent, or Singh, please ask them in the comments section below. We will continue to answer them online. To learn more about today's topic or to request an appointment, please visit baycare.net. Thank you all and have a great day.
Thank you.